Chapter 3, Video 3. We're going to talk about interventions to support wound healing. We're going to get into how you treat these wounds, like sutures, staples, dressings, bandages, drains, open and closed. So we're going to talk about that as we move forward. But first we're going to talk about sutures. There's two different types of sutures that you need to be familiar with, sutures and staples. The subcuticular suture, that's your normal suture, is placed underneath the dermis. And everybody remember that sutures are stitches, okay? So if you're not familiar with the term suture, suture is like stitches. But the subcuticular suture is placed underneath the dermis, okay? It's your regular suture. It's your, when you go and you have a small cut and you get it stitched up, this is what that is. The retention suture, it is threaded through a rubber tube over a plastic bridge. These tend to be deep, and they tend to go down into the muscle and provide more support. So if it's a large open wound, surgical, there's many different reasons why they would use the retention sutures. But if they're fearful that this area is large and it may pop back open, they'll do this retention suture, and it goes deep into the muscle, and it's larger and it holds better. That way they don't have to worry about something popping open or something happening that shouldn't happen. We're going to talk about the wound care dressings and the purpose of the wound care dressing. We need to always keep the wound clean. We want to make sure that we keep this wound clean because we want to prevent infection, okay? Anytime that we have an open wound, that is an entry point for a microbe. That is a point where a microbe or an endospore could enter into the body and cause that infection. So keeping it clean is very important. Measures to prevent infection. We need to make sure that we're always washing our hands before we perform wound care, after we perform wound care, just making sure that we have good hygiene. So there's things that we do to prevent infection. If the patient needs an antibiotic, that could be given again to prevent infection. And then we need to make sure that we maintain a moist environment that complies with wound healing. Our skin's not fully dry, and if we have an open, deep, gaping wound, we need to, that moist environment is going to promote that natural healing process. If we have wound drainage, we need to make sure that we have the appropriate dressing on there to absorb that wound drainage, because what's going to happen if you have a lot of wound drainage and exudate, and exudate is exudate, exudate is like drainage. What's going to happen is if we don't absorb that, then it's going to weep over onto the healthy skin around that wound, and then it could cause that healthy skin to break down. So making sure that we have the appropriate drainage in place, and that we absorb that drainage appropriately, that is super important. If we have infection, of course, we're going to treat that infection. And we need applying a pressure to the wound to prevent or control of hemorrhage, bruising, or swelling. So if it's a fresh wound and it just happened and you're on the scene, you need to make sure that you apply pressure, and that will help stop that bleeding. If we have necrotic tissue, this term right here, necrotic, necrotic, that is dead tissue. So if we have this nice wound here and it has dead tissue in it, that area is not going to heal. That necrotic tissue is going to have to be what they call debrided out. Debrided is D-E-B-R-I-D-E-D. Debridement will remove that dead tissue, and it will promote that healthy tissue to grow. It will trigger it to grow. We need to always protect the wound. We want to make sure that we don't cause any further damage. And then we want to protect the patient from becoming upset at the sight of the wound. Sometimes these pressure ulcers or whatever you're dealing with, they can be very large. They can be very gruesome looking. So making sure that, the patient, if they're weak, or, that we need to make sure that they don't see that wound and cause them to pass out or get sick. There's a lot of negative things that could happen there if it's one of those deep, harsh wounds and the patient feels woozy. Now we're going to talk about the different types of layer dressings, and I will go over those with you. So we're going to talk about the contact layer. The contact layer dressing, the contact layer is what comes into direct contact with the wound, okay? So it is the dressing that is laying directly on the wound bed. Most of these contact layer dressings, they allow for the exudate or the drainage to pass through. The secondary dressing, it serves as protection, okay? So the contact layer is on the wound bed. It protects that wound directly, and it allows that exudate to come through, and it promotes that healing. But the secondary layer dressing, its purpose is to hold that contact layer in place, okay? So it has the job of securing that contact layer to make sure that it doesn't move. And the secondary layer dressing is usually thick. It covers that wound. It serves as protection to keep any of the other tissue surrounding that wound bed to be broken down. There's different types of bandages that we're going to talk about. We're going to talk about the abdominal binder and Montgomery straps. So the abdominal binder is often used in patients who have had back surgery. A lot of times this provides that compression and helps support the back. But it's also used in patients who have had abdominal surgery. It just kind of, it supports that abdomen, okay? It puts that pressure. And then the Montgomery straps and the Montgomery ties, these are a form of dressing. You place these stickies on the skin, and then they tie over the wound dressing. So you kind of eliminate the need to have to put tape each time. So you have these stickies on the side, you untie the center, you do your wound dressing, and then you pull these ties back over that dressing, and it removes that need for having to pull tape on and off of the patient's skin each time that you change that dressing. This is a transparent dressing. You will see here they've started this IV, and then we've put this clear dressing over this. That way you can get a visual on what that IV looks like. You can tell if it's becoming red or inflamed around that IV. And there's different types of, there's different reasons that we use these occlusive dressings. But the transparent dressing here, you can see through it. That's the purpose of it. They stick really good, they protect, and you can see through it to watch what's happening with that wound healing. Tell whether the following statement is true or false. When applying a dressing, the contact layer is applied directly to the wound. The answer here is true. That contact layer goes directly against the wound, and it's generally made of a non-stick material or gel. So when we were talking about the abdominal binder, this gives you an idea of what that abdominal binder looks like. And I was looking to see, I don't think I have a picture of the Montgomery straps or the Montgomery ties. But you can Google those, and you can get a visual on what I mean by that. I think once you see them, it will make sense to you as to what you're looking at there. That is it for Chapter 3, Video 3. If you have any questions, please let me know.